You might think you already know everything there is to know about your own body, especially something as intimate and personal as masturbation. After all, it's something you've been doing for decades. You learned it in your youth. It's been with you through different stages of life. And by now, over 50, you probably see it as a harmless, even necessary part of your routine. But what if I told you there's a part of the story that almost no man over 50 is aware of? What if I told you that your penis right now might be going through changes you can't see? Changes that don't hurt, don't itch, and don't give any obvious warning until it's too late. At this age, your body is not the same machine it was at. Your hormones, your blood vessels, your connective tissues, and even your nerve endings respond differently to stimulation. And yet, many men keep treating their sexual activity, especially solo activity, the exact same way they always have, without realizing that in older age, the recovery process is slower, the tissues are more delicate, and the risk of long-term effects is much higher. The truth is, when you're young, frequent masturbation has little noticeable consequence because your testosterone is high, your collagen is abundant, and your blood flow is at its peak. Micro damage to the erectile tissue heals almost instant. But after 50, testosterone levels drop, collagen fibers become stiffer, and the smooth muscle in the penis becomes more vulnerable to overuse. That means every single time you stimulate yourself, you're creating a demand for oxygen-rich blood, a surge in pressure, and microscopic stretching of the erectile chamber. If the recovery time between these events is too short, small injuries too small for you to feel can start to accumulate. Over months and years, these micro-injuries can turn into fibrous tissue, which doesn't expand or trap blood as well. This can lead to weaker erections, reduced sensitivity, and even a visible change in size or shape. And here's something most men never hear. The first sign of damage isn't usually in your bedroom, it's in the mirror. A subtle curve that wasn't there before, skin that seems looser or less elastic, a feeling that your erections don't fill out the same way. But because the change is gradual, you don't notice until you compare yourself to how you were years ago. Even worse, erectile tissue health is directly tied to your cardiovascular system. The arteries in the penis are narrower than the ones in your heart, which means they can show signs of circulation problems years before you ever feel chest pain. If your erections are changing, it could be your body's way of whispering that something's wrong with your vascular health. Something that might not just affect your sex life, but your life itself. And yet, most older men don't connect the dot. They blame it on getting older and keep going, sometimes even increasing the frequency out of habit or boredom, not realizing they're speeding up the decline. There's also the matter of sensitivity. Nerve endings in the penis become less responsive with age, but overstimulation can accelerate that process, leaving you dependent on more intense stimulation to achieve the same pleasure, which in turn puts even more strain on the tissue. It's a vicious cycle, and it's one that rarely gets talked about because it's private, even taboo. And let's not forget the mental side. Many men over 50 find themselves using masturbation as a stress relief, as a sleep aid, or simply out of routine, without realizing the physical cost. Every time you do it, your body releases dopamine and prolactin, chemicals that can temporarily lower testosterone levels. When done in moderation, your body recovers quick, but when repeated too often in older age, that hormonal dip can become harder to bounce back from, leading to a gradual decrease in overall sexual energy and drive. Now, I'm not saying you need to stop completely. This isn't about shame, it's about knowledge. It's about understanding that your body has changed, and your habits may need to change with it if you want to keep your sexual health intact for the years ahead. Most men only start asking questions when it's already too late, when they've noticed a real change in performance, when they feel embarrassed, or when they've had a doctor tell them something is wrong. By then, recovery is possible, but it's much harder. The reality is the penis is like any other part of your body. It ages, and the way you treat it can either slow that process or speed it up. If you're over 50 and still following the same patterns you did at 20, you might be setting yourself up for a future of weaker erections, reduced pleasure, and even underlying health problems you never connected to what you do in private. And in this video, we're going to uncover exactly what happens inside your penis when you masturbate in older age, the hidden risks no one tells you about, and the changes you can make right now to protect. Because if you think it won't happen to me, you might already be in the early stages without even realizing. When you reach your shrinkage, the tissues inside your penis are no longer as resilient as they once were. At a microscopic level, the erectile chambers called the corpora cavernosa are made up of a delicate network of smooth muscle fibers, elastic connective tissue, and countless tiny blood vessels. During arousal, these chambers fill with blood under pressure, expanding and trapping that blood to create an erection. In younger years, these tissues can endure repeated high-pressure events without lasting damage. Because the collagen is supple, the elastin fibers snap back quickly, and the blood vessels repair themselves with ease. But as testosterone declines, so does nitric oxide production, a chemical your body needs to relax blood vessel walls and allow strong blood flow. Without sufficient nitric oxide, erections can be weaker, and the tissue experiences more strain with every use. Imagine inflating a balloon that's been sitting in a drawer for years. The surface becomes stiffer, less elastic, more prone to tiny cracks. That's what can happen to your erectile tissue if it's subjected to the same frequency and intensity of masturbation you practiced in your younger years. Over time, those tiny cracks are replaced with scar-like collagen fibers, a process known medically as fibrosis. Fibrosis in the penis is not just cosmetic, it physically reduces the tissue's ability to expand fully, which can lead to a condition called venous leakage, where blood escapes too quickly to maintain an erection. This isn't a rare occurrence in older men, it's far more common than most realize, but because it develops slowly, it often goes unnoticed until the change is significant. Worse still, the buildup of fibrous tissue can trigger Peyronie's disease, where hardened plaques cause the penis to curve, sometimes painfully during erection. Many men don't realize the first stages of Peyronie's disease can be linked to repetitive microtrauma from vigorous or overly frequent masturbation, especially when performed with a tight grip or in positions that bend the shaft. And here's where the danger deepens. Penile health is directly tied to your cardiovascular system. The arteries in the penis are only about 1 to 2 millimeters in diameter, which means they're the first to be affected by atherosclerosis, the same plaque buildup that causes heart attacks and stroke. If you develop circulation problems in the penis, it can be an early sign, sometimes years in advance, of serious heart or brain vessel disease. Yet because masturbation is private, and erection changes are seen as normal aging, this early warning system is ignored. Hormones add another layer to the risk. Each time you climax, your body releases prolactin, which temporarily lowers dopamine and testosterone. In a young man, this is just part of the cycle, and levels bounce back quickly. But for men over 50, whose baseline testosterone is already lower, frequent masturbation can keep testosterone suppressed for longer periods. Low testosterone isn't just about libido, it's directly linked to muscle loss, fat gain, fatigue, depression, and even insulin resistance. It can create a vicious cycle where lower testosterone leads to less sexual satisfaction, which leads to seeking more stimulation, which then lowers testosterone further. Nerve health also comes into play. The penis contains thousands of sensory nerve endings, many of which are concentrated in the glans, the head. These nerves are designed to detect subtle changes in pressure, temperature, and texture, but overstimulation, especially with excessive pressure or mechanical devices, can desensitize them over time. That's why some older men find they need more and more intensity to reach climax, a condition known as death grip syndrome in casual terms. Once nerve sensitivity is reduced, it's extremely difficult to restore, because nerve regeneration in older adults is much slower. Even the skin of the penis changes with age and overuse. Collagen loss can make it thinner and more fragile, increasing the risk of microtears, which can lead to inflammation and discoloration. Repeated friction without adequate recovery can also cause the skin to lose elasticity, making it looser and less responsive. There's also the issue of pelvic floor muscles, the same muscles you use to stop urinating midstream. These muscles help trap blood in the penis during erection, but overuse without proper strengthening can fatigue them. A weak pelvic floor can lead to weaker erections, and even urinary leakage, problems that many men assume are just part of aging, but can be accelerated by unbalanced sexual habits. And while all this may sound purely physical, there's a powerful psychological component too. Masturbation releases dopamine in the brain, which is part of what makes it pleasurable. But over time, high-frequency masturbation can dull your brain's dopamine receptors, reducing the reward you feel not just from sex, but from other aspects of life. This can subtly erode motivation, mood, and even social confidence. Men who unknowingly fall into this trap may start to feel more isolated, less driven, and less connected to their partners, without ever realizing that their daily habits in private are influencing their mental state. The real danger here is not that masturbation is inherently bad, it's that in older age, the same routine you once considered harmless can have a very different effect on your body, one that slowly chips away at your sexual health, your hormonal balance, and even your long-term well-being. This is why understanding the science is critical, because if you're over 50, every choice you make about your sexual habits matters more than it did before. And in the next part, we're going to go even deeper into what changes you can make to protect yourself, restore some of what you may have lost, and ensure that your most private part stays healthy for years to come. If you're a man overthinking, this is the part you absolutely cannot afford to ignore, because it's where we shift from what's already happening to your penis to what will happen if you don't change your habits starting today. The most dangerous thing about age-related penile decline is that it's silent at first. You might still be getting erections, still enjoying climax, still thinking everything is fine. Meanwhile, microscopic damage is accumulating with each session. Over months and years, the smooth muscle cells inside the corpora cavernosa are gradually replaced by stiff collagen fibers. Not because your body is trying to harm you, but because it's trying to repair tiny tears and micro-injuries from overuse. Unfortunately, that repair comes at the cost of flexibility. Each time this happens, your maximum erection hardness drops slightly, and you don't notice until you've lost. At that point, many men panic and turn to pills like Viagra, thinking the problem is purely blood flow. But in reality, the architecture of the penis itself has changed. Those pills can force more blood into the chambers, but if the chambers themselves are rigid with scar tissue, you'll never get back the fullness you had in your youth. The blood vessels feeding your penis are another critical point. After 50 endothelial cells, the inner lining of blood vessels lose their ability to release nitric oxide efficiently. Combine that with repetitive high-pressure blood flow from frequent masturbation, and you're putting your pineal arteries under chronic stress. The result? Microscopic endothelial tears that attract cholesterol, platelets, and inflammatory molecules, starting the exact same process that clogs heart arteries. And remember, the arteries in your penis are the smallest in your body. This means they're the canary in the coal mine for cardiovascular disease. If they're damaged, your heart is next. Some men ignore early signs like morning erections fading, or needing more direct stimulation to get aroused, thinking it's just age. In reality, these are red flags that your cardiovascular health might be deteriorating in dangerous ways. There's also the overlooked issue of chronic pelvic inflammation. Each time you climax, there's a temporary inflammatory response in the pelvic tissues. This is normal. But if you don't give your body enough recovery time, the inflammation becomes persistent. Chronic inflammation can weaken the pelvic floor muscles, irritate the prostate, and compress the pudendal nerve, the main nerve carrying sensation from your penis to your brain. This compression can cause tingling, numbness, or even sharp pains during arousal. Worse, inflammation can also make your prostate more vulnerable to both benign enlargement and malignant changes. There is growing evidence linking high-frequency ejaculation in older men with increased oxidative stress in prostate tissue. Oxidative stress is when harmful free radicals outnumber your body's antioxidants, damaging DNA and cellular machinery. While some studies suggest that regular ejaculation may have protective effects in younger men, those benefits may flip to risks in older men with already weakened antioxidant defenses. And here's where things take a darker turn: loss of sensitivity. Once your sensory nerve endings are dulled, you not only lose pleasure, but you risk developing erectile dysfunction from the brain down. Erections are not just mechanical. They start with a sensory signal traveling to the brain, triggering a cascade of nerve impulses and blood vessel change. If the input signal is weak because the nerve endings are damaged, your brain won't fully activate the erection response. That's why men who have been masturbating the same intense way for decades often notice they can no longer climax during intercourse. They've conditioned their brain to respond only to one specific kind of stimulation. This neurological wiring becomes harder to reverse with age, because neuroplasticity, your brain's ability to rewire itself, slows significantly after your 50s. And then there's the mental side. Dopamine receptor downregulation. Basically, your brain stops responding as strongly to pleasure signals can make you feel like life itself is less enjoyable. You might think you're just tired or burned out, but in reality your brain chemistry has been reshaped by years of overstimulation without proper balance. Some men spiral into mild depression, increased anxiety, or compulsive behavior patterns without connecting them to their sexual habits. Add to this the hormonal roller coaster: prolactin spikes after orgasm, lower testosterone for hours, sometimes days in older men. Lower testosterone means less energy, less motivation, more fat storage, more joint pain, and ironically more erectile problems. This creates a self-perpetuating loop: more masturbation for comfort or escape, more hormonal suppression, more physical decline. And while all this sounds grim, the most important thing to realize is that you can intervene right now, before the damage becomes irreversible. Reducing frequency is not about abstinence, it's about recovery time. If you're currently masturbating daily, try spacing it out to every 3-4 days to give tissues a chance to heal. Use a lighter grip, vary your technique, and avoid bending the shaft. Support your vascular health with exercise, especially resistance training and walking, which boosts nitric oxide naturally. Maintain a diet rich in antioxidants, dark berries, leafy greens, fatty fish, to counteract oxidative stress. Strengthen your pelvic floor muscles with targeted Kegel exercises, but balance that with relaxation stretches to avoid chronic tension. And most importantly, monitor your sexual function as a vital sign. If you notice changes in morning erections, sensation, or hardness, see it as an early warning for your overall health. Because here's the truth most men never hear: the way you treat your penis after 50 can determine not only your sexual future, but your cardiovascular and hormonal health for the rest of your life. And in the final part, we're going to talk about the hard reality: what happens if you ignore all of this and just keep going, and why some men never get a second chance to fix. This is where things get brutally real, because if you're a man over 50 and you ignore every warning sign we've talked about so far, the decline won't just be gradual, it will accelerate, and one day you'll wake up and realize something has happened that you can't undo. The biggest myth men tell themselves is, if something goes wrong, I'll just take a pill and fix it. But here's the truth: Once scar tissue has replaced your epithelium, there's no pill on earth that can make that tissue supple again. Once the arteries in your penis are hardened with plaque, surgery might restore some blood flow, but you'll never get the same spontaneous, full, throbbing erection you had in your youth. And here's something even more chilling. Penile shrinkage. As smooth muscle fibers are lost and replaced with collagen, the elasticity of the tunica albuginea decreases. This leads to a measurable loss in both length and girth, sometimes up to an inch or more over a few years. Many men notice this only when it's too late, blaming it on weight gain or aging. But the underlying cause is structural change inside the penis itself. And then there's the real nightmare, Peyronie's disease. Repeated microtrauma from aggressive or frequent masturbation in older age can cause plaques to form, leading to painful curvature. At first it might be just a slight bend, but in some men, the curve becomes so severe that intercourse is either painful or impossible. That's not just a physical blow, it's a psychological one. The shame, the frustration, the feeling of being less of a man can spiral into anxiety, depression, and withdrawal from intimacy altogether. Meanwhile, your prostate, already vulnerable with age, is under constant inflammatory assault from too much ejaculation without enough recovery. Chronic inflammation can trigger benign prostatic hyperplasia, which means getting up 3, 4, even 5 times a night to urinate, never sleeping deeply, living in a constant state of fatigue. And while BPH is not cancer, the same conditions that fuel it, oxidative stress, hormonal imbalance, DNA damage, can also increase the likelihood of malignant changes over time. Imagine sitting in a urologist's office, hearing the words, "We found something suspicious," and wondering if years of ignoring your body's warnings played a role. On top of this, the nerve supply to your penis can suffer permanent damage. Pudendal neuropathy, caused by chronic pelvic floor tension and inflammation, can leave you with persistent numbness, burning sensations, or stabbing pains that don't go away even when you stop masturbating. Once those nerve fibers are damaged beyond repair, no medication, no therapy, no surgery can bring back full sensation. You'll still be able to go through the motions, but the deep, powerful pleasure you remember will be gone, and that's a loss most men never truly recover from emotion. Hormonal decline accelerates too. With repeated post-orgasmic prolactin spikes and prolonged testosterone suppression, your muscle mass drops, your belly grows, your energy fades, and your libido itself weakens. And here's the cruel twist. Once libido is gone, erections vanish even faster. Your body adapts to the lack of sexual demand by downregulating the entire erectile system. This is why some men in their late 50s or early 60s find themselves suddenly impotent after decades of activity. They cross the threshold of damage, and the system shut down. Let's not forget the cardiovascular connection. The same arterial damage in your penis is almost certainly happening in your heart and brain. Men who develop erectile dysfunction in their 50s have a significantly higher risk of heart attack or stroke within 3-5 years if they don't address the root causes. That means your penis might actually be trying to save your life by warning you early, but if you silence that warning with pills instead of lifestyle change, you're gambling with far more than your sex life. There's also the emotional toll on relation. Even if you have a partner who loves you deeply, the loss of intimacy can create distance, misunderstandings, and resentment. Many men retreat into pornography or fantasy when their real-life sex life declines, which only deepens the neurological conditioning and makes recovery hard. Before long, you're in a cycle of solitary pleasure that no longer satisfies, coupled with a creeping sense of isolation and regret. And the worst part, for many men, the realization comes too late, after the damage is done. They look back and think, if I had just paced myself, if I had just paid attention to those early signs, if I had just treated my body with the respect it deserved. But by then, they're dealing with irreversible changes, penile fibrosis, nerve loss, vascular disease, hormonal collapse. That's why the only smart move is to act now. Give your body the rest and recovery it needs. Limit intense sessions. Focus on whole body health. Cardio for blood flow, strength training for testosterone, a clean diet for vascular protection. Get your hormones checked, your cardiovascular health evaluated, your pelvic floor assessed. Learn to stimulate yourself in ways that don't cause trauma. Lighter grip, slower pace, more focus on mental arousal instead of pure friction. If you start today, you can slow, even partially reverse some of the decline. You can keep your function, your sensitivity, your confidence, and your connection, not just to your partner, but to your own masculinity. But if you ignore, understand that every choice has a consequence, and in this case the consequence could be living the rest of your life in a body that no longer responds the way you want it to. And that is a reality you never want to